Welcome, everyone, to the Your Little Castle show. It is important that we take care of those who have taken care of us
Right.
our whole lives. Most of us have had some leadership, some people that help to keep us on the path. And so with that, we're talking a little bit about how do you help best for yourself, for your family, keep on track, make sure what's going on. I hated taking tests, like they say back in the day. But when you're just saying, hey, you're going to just do a little swab here, and then you're going to come back and tell me all the answers. That makes life quite a bit easier, doesn't it? Welcome everybody to the Your Little Castle show again. We got John Parker. He's the CEO and founder of Medical Testing Services and Consulting. Welcome to the show, John.
Glad to be here, man.
Well, tell me what's it like? You're in a realm now where you're impacting some lives here.
This is uncharted water for me, for sure. My mind, kind of like yours, when you're asleep at night and you wake up and you just crazy things pop into my head, and somehow, and I'm taking care of right now. I'm taking care of my 86-year-old mom. And she doesn't think I'm taking care of her because she's 86 and I still get slapped in the head when I come in the house. And, she's still very, very mobile, drives her own car and all that good stuff. So, but I'm still taking her to doctor's appointments and still very much in tune with her medical status. She's had some cancer and some recent surgeries and everything, but she's still kicking around pretty good. But taking care, when I've noticed this, my mind is it just started racing. And, I came up with this statistic that by the year 2030, there will be more people in this country over the age of 65 than under the age of 5, as the census has given me this information. And with that, our nursing homes and skilled nursing facilities, retirement homes, are going to explode. Okay, so in those nursing homes, and I know nursing directors and people who run these places, they don't like to hear me say this, but they're almost like hotels. And
Sure.
The fact of the matter is, nobody makes any money unless there's a head on a bed. And these places, some of these places are incredibly beautiful, but they're also incredibly expensive. Luckily, most folks have Medicare, Medicaid, and private insurance that takes care of them. But and with that being said, the medical industry has changed over the last 20 or 30 years. It used to be, when you went in to a hospital, which is still very expensive to this day, they would treat you and for whatever symptoms you had, and they would kick you out. You're gone, you're done until you have to come back here. Where now with nursing homes growing as I've seen them grow in the last 15 years or so, those nursing homes, the medical industry has kind of shifted, and we're trying to get to a stage where we're getting out in front of a lot of diseases and a lot of viruses. And let's not fool ourselves. COVID changed the game for a lot of people. Okay, so we're able now to get out in front of viruses and get out in front of diseases with the testing that I do with the company and with our lab, GenView DX. We're able to get out in front of some of these things and be able to keep people healthier and to get out in front of the diseases and the viruses and things like that with our testing methods. And this keeps them, as they get older, it keeps them out of the hospital, which is always an expensive deal to go to, no matter what age you are. Obviously, as you get older, the ailments get more in depth, and anytime you go into a hospital, it's going to cost you a whole lot of money. One of the biggest ways to go in debt in this country is medical bills.
Yeah,
So
I understand it's the number one cause.
it's the number one cause of debt in this country is medical bills. So if we can keep people healthier, and with the testing that we do, the lab that we work with, we've seen a 20% rise in mortality. to be able to help people live longer, keep them healthier, get out in front of the things that they have or could potentially have, especially with our genetic testing, what they have predispositions for. And if we can get them started on medication early, we have a chance to increase their quality of life, keep them alive longer, keep them around their families, and just and keep them here. I mean, my mom's 86, and I would love to keep her around as long as I possibly can because she's she's like one of my best friends. So this is kind of a with her in the back of my head,
right.
A little bit of a push, and she kind of chuckled at me. She said, after 32 years of football, now you're going to do medical testing after 24 years in the communications business. Now you're just going to go into medical testing. And I said, yeah. And she's like, okay, good luck. So, but it's worked out really well. And facilities love what we do. So I'll tell you a little bit. We do, our medical testing consists of, respiratory viruses, COPD, pneumonia, things like that. Pneumonia, you'd be surprised. Pneumonia is huge right now. It's on the rise. RSV, those things like that. We do urinary tract infection testing. Okay. With that, people don't understand. Folks in nursing homes spend a lot of time in the bed.
Right.
And, when someone gets a urinary tract infection, it doesn't show up right away. But, a lot of people will say, oh, my back is hurting. Well, the usual standard answer was get out of bed, move around. You've been laying around too long.
Right.
Well, most of these folks aren't that mobile, okay? And it's not because their back isn't hurting because they're not mobile. Their back is hurting because they have an undiagnosed urinary tract infection. Ask any nursing home worker. That is the number one problem in nursing homes is UTIs. And so our testing method, we can find out instantly if they have a UTI and get them started on the medication, because UTIs can go into your brain. And if you're an older adult, it can really affect your quality of life. People start acting a little crazy because and it's simple because they have a UTI and nobody ever diagnosed it. Wow. And it's, we have things like that. So that and the respiratory. But, our biggest thing, is genetic testing. We perform a genetic test. It's a simple swab in the mouth, and we can diagnose for predisposition of cancer, of Alzheimer's, of ALS. We can get these predispositions out. We had a perfect example. We had a lady in the home. This is a few weeks ago. She already had breast cancer, but we did a genetic test on her, and she came back with a predisposition for ovarian cancer. 1 week later, she went to the doctor. She had a cyst on one of her ovaries, and they removed her ovaries. Now she gets to live longer, but nobody would have ever found that.
Yeah, so what you're really allowing to do here is to give people information.
Oh,
to say,
God, yes.
Here's something that's coming down the pipe, predetermined, pre-diagnoses, weeks and even
You
maybe
may
years
get it,
in
you
advance.
may not, but you have a predisposition for it. So why not get out in front of it now? And we can start people on medication. We can start them on cognitive therapy methods if they have a predisposition for Alzheimer's. Things like that. We can get out in front of these things right now and improve their quality of life and increase their how long they live on this.
Yeah, I was going to say, as a matter of, most people would prefer to be in a care facility. It's more like it's like a resort versus.
Oh, some of them are.
Going
oh my
to
gosh! I mean, you walk in some of these places, it's like, wow. I mean, this is like one of those resorts down in Mexico, and people are bringing you food, and the floors are like Egyptian wood, and I'm like, I want to live here when I get old. I want to move out of my house and just move right in here. So some of these places are very, very nice, but the medical care that they're getting, I'm not going to tell you it's not up to par. Sometimes it's just undiagnosed. So what we do is we go in and we try and help not only the facility, but the patient himself, his or herself, and improve their quality of life. And the greatest thing that some of the greatest things I can tell you about it is this: it doesn't cost the patient anything because Medicare, Medicaid, most major insurance already pays for it. Okay, it doesn't add any work to the staff of the facility because we send our team in to do all the testing. So when our team comes in, John Parker shows up at 8 o'clock in the morning with 8 dozen donuts and says, "You guys are off for the morning. We take care of it. If it takes past noon, I'm ordering pizza for everybody. Relax. You guys got the morning off. We're taking care of everybody in the house." So,
yeah, well, back to what you were talking about there. I mean, it's a matter of here is an opportunity to really give somebody
Right.
a big advantage to here's things that we know are coming genetically been tested. I was doing some research. The Mayo Clinic talks about this quite
Right.
a bit. And if you can have some indication based on DNA markers, they analyze your DNA, get that from blood or I guess now just a
swab. It came to pass back in the early 90s. It's PCR testing. And it was actually used, I hate the reference, but it was used during the OJ trial. Okay. And nobody kind of pushed it out there from a medical standpoint for years afterwards, and it's still not very popular. I mean, it is cutting edge technology because most people are going through blood and cultures, and I'll tell you right now, do we have the capability of doing blood work? Do we have the capability of doing cultures? Yes, we do. But I don't want to do that stuff. I want the nursing homes and these skilled nursing facilities to be on the cutting edge of technology, to be able to keep their patients happy and healthy and live longer and in that facility. Like I said, at the end of the day, it's no work. It improves the quality of life for your patients. We do all the work for you. So it works out great for everybody. And to me, it's kind of a no-brainer. I mean, that's why we have so many facilities in town, because they're like, oh, yeah, we want you guys to get in here now. I mean, we come in, we're going to test you at least once a month, and we're on call. So if you got somebody in your nursing home that, appears to be, not well, send us in, and we're going to get your test results back to you 24 to 48 hours automatically.
This is a big advantage for the care facilities, the home care facilities, because now they have a happier client.
Oh,
they don't want to go to the hospital. As a matter of fact, they might lose the client.
Well, happier families too, because their families are usually the ones who are paying for them to be in there, and if the quality of life of their family member, their older family member, is not great, nobody's happy. So
right.
This keeps the patient happy. It clearly keeps the facility happy because there's no added work to any of their staff. When you get your results back, not only does it have the virus or the disease that they have, but it also has the recommended medication. So the medical director just looks at the sheet and says, okay, call it in. This is what they have. This is what's recommended. And it works out great for everybody.
Yeah, well, it's a matter of if you're going to give somebody such an advantage. I mean, if I'm running a facility, I want to know this about my patients.
Absolutely.
Because I can better serve them to say, hey, let's take care of some of this with some medication and some treatment here in our facility, because once you send them off to the hospital,
right. They may not get them back.
They may not come back, but there's also then the bills go up, and they're talking, that's like the reactive approach versus
they may not
being
come
proactive.
back because sometimes when they go back to a hospital, they're not only dealing with the medical staff, but they're also dealing with the social worker in that hospital who is responsible for sending them to a facility. So if a facility sends someone to a hospital, they may not necessarily get them back. Now that facility has lost money.
Right.
Okay. At the end of the day, it's still modern medicine, and it's still about money some days. Okay.
Yep.
But that facility knows it. Like I said, it's kind of like that hotel. If that head is not on the bed at that night, we just lost money on an empty room.
Yeah, okay? And you didn't best serve your client as you could have,
right.
by saying, here is some preemptive testing. We can
absolutely
explain here things that are down the road. Let's get on. Why wouldn't you want to know about this 3 years in advance? Like my father went through this, and his big issue was he did not want to go to a facility. So right. we had in-home care, which was nice, except that it was after all the damage had been right. done. If we had some predisposition that we had known about, right. he had a stroke and a brain bleed, if we'd have been able to tell these things are coming down the path, then you can keep that from happening.
Out in front of medicine, you hate to say it, but there, you know, there's no money in the cure. The money is in the treatment.
Right.
You know, I mean, I hate that. You know, the greatest thing about what we do is that we're helping to save people's lives. I mean, there's no getting around that. The bottom line is we get to improve the quality of life for people, and we get to do it at no cost to them and at no added work to the staff that we at the facility that we handle, that's one of our clients. And facilities right now are they love us. I mean, they love what we do. I mean, because and these executive directors, I just had one last week, walked in with all of her test results, and in the initial consultation, she's like, well, but our folks, we don't have any of that stuff going on. We don't have any of this. And I walked back in with a file this thick. I'm like, listen, I got good news and I got better news. I mean, here's the good news. This is how many people have something going on that we can get out in front of right now. Okay, and the better news is here's the recommended medication. Okay, let your medical director and your director of nursing just hand the file to them, and they're going to run with it. Medical directors and directors of nursing at these facilities absolutely love us. The executive director is loving us because you guys are keeping our people healthy. We're getting out in front of things right now, and I've got more appointments than I know what to do with right now, which is great. Everything's good for business. So it's wonderful being able to do this, but it's very, very refreshing to be able to improve the quality of life for just the people who are in these facilities. I mean, it makes you feel kind of good when you put your head down in that.
Yeah, I was gonna say it's got to be awesome for this facility to be able to say to their guest, their client,
right,
hey, here's some things that we need to start paying attention to and be able to pre-diagnose.
Exactly.
Because right now it's mostly reactive. Oh, that Bill fell down. We got to get him up his hip. But what if we could tell Bill he's got a heart condition that hasn't showed up yet, and we're going to have to we can start to treat that now, and like you say, extend his life.
It's things that they can pay attention to. So if you got someone who has a predisposition for Alzheimer's, you can start paying attention if their cognitive level starts dropping. Okay, you can get them started on medication now. You can get them started into some type of therapy or some type of testing now. Okay, if they have a predisposition for some of these things. Cancer, you can get out in front of right now. You can get out in front of ALS. You can get out in front of everything. We're gonna test for 52 different pathogens. I mean,
wow.
You would be surprised how many people in these homes have a staph infection and don't know it. And staph will kill you. I mean, if it gets out of control, it will kill you. So we find these things out, and if it comes back, yes, they have a low level of a staph infection, we can get them on medication right now and get it all cleaned up. Okay.
Wow. Okay.
I mean, this is working out really well, and like I said, nursing homes, skilled nursing facilities, retirement homes, they love what we do because it takes a load off of their staff knowing these things right now. It increases the quality of life for all the people living there, and it doesn't cost them anything, and it doesn't take up any time of the staff. It doesn't, these people in these nursing homes are so overworked. I mean, you're talking about a staff of 10, 15, 20 nurses, and there could be 200 people in this home, and you're hustling. Yeah. So if I got the ability to give somebody a morning off and say, hey, we're going to take care of all your testing today, and here's donuts for breakfast and here's pizza for lunch, we're going to take care of you today, because we're going to find out all the issues that you're going to have to face here in the next week or two, and we're going to be out in front of all of this. And your medication's already going to be there, so let's get these things called in. Yeah,
well, it really gets to bring a bright light to somebody to say, hey, man, this is some stuff, we caught it early, so now we're going to be able to get this so it doesn't, if you'd heard about this 6 months from now, we'd be a different story.
Well, it is. That's what it's a big difference. Sometimes with a UTI, it can be a few days. You know, if it's not diagnosed, it can be, if it goes longer than a few days, a week. The older you get, the lower your immune system is to certain things. So, you know, it's not like I was 25 years old and I can remember when I could get my knee scoped on Monday and play on Saturday. It's
Right.
not like that anymore. Now, if I get my knee scoped, I'm down for 18 months. I'm not walking. I mean,
Right.
it's not that way anymore. So, as we get older, our ability to recover from things, it just diminishes. It's human nature.
Sure.
Okay. So if we can help someone get out in front of something that's coming down the pike, or something that they already have that we can get control of right now, let's do it. Let's do it. That's the bottom line when we walk in. When I walk in to try and try and get new business, is we're going to increase their quality of life. We're going to help them live longer, and we're not going to add any work to you guys. That's what we do, and it's not going to cost anybody anything.
Well, I guess there's also potential to save people a lot of money, because some of these surgeries, people,
God, yes.
they were talking to my mom just about her knees. This wasn't like a heart valve replacement.
Well, that's going back into
20,
the hospital.
30, 50, yeah. And just so much more money, and then where's the path from out of there?
Once you go back, if you have to go to the hospital, it costs an enormous amount of money. I mean, you know, my wife got a hospital bill from a procedure, and the bill was $32,000. Now, luckily, I had health insurance.
Right.
Great, and I'm like, wow, you hit our deductible like the day you walked in the door.
Right.
I'm good with this now. Okay, you know, you're going to pay. I'm paying 3 figures instead of a large 5 figures that, you know, could send me to the poorhouse pretty fast. Okay?
Right.
I mean, again, it's the number one cause of debt in this country is medical bills. If we can keep people from going to the hospital and having stays in the hospital, you know, why wouldn't we want to do that? You know, and we can, again, we're helping people, we're helping their quality of life, and it's not costing them anything. That's the biggest factor. You know, where we are in the economy, where we are with inflation, where we are with just having money in our pocket to do the things that we have to do. Why wouldn't we try and alleviate the things that, you know, we can get a hold of? Let's get out in front of some things.
Okay. Well, John and I talked a little bit about it. If you are the director at a facility,
The director, the medical director, the director of nursing, yeah, we'd love to have a conversation with you and show you what we can do, what we will do, and I guarantee you're going to smile because, one, it's not going to be any added work to you, and we're going to help you increase the quality of life for the residents and the patients at your facility. And it's not going to cost you anything. It's not going to cost the facility anything. It's not going to cost the patient anything. We do all the work.
great. And we will highlight them. We'd like to talk to them, have a discussion. We can spotlight you guys, put you on our show
Absolutely.
here, talk a little bit about what you do, how you serve the community, what you're doing to make a difference in this little
I
planet.
mean, I know you're doing work in there. You got to go in there, and they want you to come in. I mean, I'll come in. I'll just hold the bag. I'll just hold your bag, bring the bag.
Yeah, I've got to do my little dance and run around
There
a
you
little
go.
bit and say hi to everybody. But yeah, I've visited a number of facilities. I'm going to put you in touch with a few. I would like to bring some of those. I won't name of them out loud here on TV right now, but if you guys, I'm going to reach out. We're going to bring you guys. We'll sit you down here, talk a little about what you do, and then I can introduce you to John and maybe do some work to help you guys really improve
to.
the lives of your patients
Right.
and make people really happy to live
To
there.
me,
a
it's
long
kind
time.
of a no-brainer. I mean, you know, everybody's really tight with the wallet right now. I mean, if we can provide quality health care to a facility, to a patient, and it doesn't cost them anything, and it doesn't require any added work by you or your staff, I don't understand why you wouldn't want to do this. I don't. I don't understand why you would. And your test results are all coming back in 24 to 48 hours. You're going to have everything back on every patient that you have that we've tested, and let's get out in front of any issues that they and believe me, if you're a director at these facilities, your patients have issues and you don't even know it.
Right.
And that's the biggest factor, because sometimes, most of the time, once you find out they have this issue, it's almost too late. You got to get them to a hospital, and there's no guarantee that they're coming back to your facility. It's just not. That's just the way it works in the social working world.
Well, if you guys know John and my background together, John was my coach. I kicked for him for many years ago.
A long time ago.
And I got to know him through all the football and the fun sports stuff we did. But the point of that was there's so much as a competitive business. That's what that's the advantage. The success is created by always looking for ways to improve. And this genetic testing, this stuff is coming. Well, it's a matter of if these facilities, it's here.
It's here now.
They better be on the ball, getting in touch with somebody who's an expert for this, and you're leading the path here.
Lots of folks are still doing blood work, and they're still doing cultures, and that's okay. It's low technology.
Right.
I mean, I remember when all cars were standard. They were all everything was a stick. Yes, I am that old. I remember when the H pattern on the column.
Right.
Okay, but it's not that way anymore. And as technology changes, our thought process for healthcare has got to change with it. And because of that, genetic testing and respiratory testing has gone to a different level. Now, am I going to tell you that we're the only people in the United States doing this? No, because there's probably half a dozen companies that do it also. But those other companies, the difference between us and them is that they're going to mail you the kit.
Gotcha.
Okay, and they're going to say, we want you, if you want to do this, you guys are more than welcome. You guys do it. You guys take care of FedExing it in, and you guys take care of getting your own stats, which they're going to charge you for to get the stats back to see what they have and what the recommended medication is. We don't do that. The whole idea is to make this seamless and painless to the facility so that it becomes a no-brainer that why wouldn't we let someone else come in here, give us new technology to help us get out in front of diseases and viruses and predispositions for things, help us get out in front of it, and it doesn't cost us anything, and it doesn't add any other work to us because we come in and do it, and we get our results back and all the stats that go with it. They take care of mailing out everything overnight, and they get all of our test results back to us in 24 to 48 hours, and we don't have to do anything but eat donuts and eat pizza that day. I mean, I don't know if it gets any easier than that, but if you can come up with a different scenario that works, and you guys don't have to do it, more power to you. We're going to take care of all this stuff, though. So,
as we finish up here, everybody, get a hold of John. If you run a facility, home care, health care, long-term care facilities,
yes. memory care, big time.
That's where they need
retirement homes, retirement facilities, nursing homes, long-term care facilities. I mean, that's our wheelhouse. That's what we do. And there's other people out there who are gonna want to do the same thing, but at the same time, they're gonna send you the kid. They're gonna say, "You guys do the work. We do the work for you."
All right, everybody, get a hold of John. Take care of you guys. med-testing.com. Giddy up.